You have hip pain and your doctor tells you that it's coming from your back, the x-rays tells you it's your hip, and you still have no idea which one is actually causing your pain. Here's something that surprises people. A hip problem can feel exactly like a back problem, and a back problem can feel exactly like a hip problem. They trade disguises constantly. So if you're asking, is it my hip or is it my back? This video gives you the specific clues that point one way or the other. And just as importantly, why even those clues are not the final word. I'll walk you through where each one tends to hurt, what each one does when you move, and the one symptom that points hard towards the spine almost every time. The last one is the clearest single tell we have. I'll get to it, so stick around. I'm a fellowship-trained spine surgeon, so I'll be straight with you about something most of these videos won't admit. It's generally hard sometimes to tell in a patient with hip pain if that pain is coming from the actual hip joint or if it's coming from the back or the SI joint. There's even a name for when it's both the spine and the hip at once. We'll get to that. First, let me show you why this is so confusing, because once you see it, the clues make a lot more sense. The hip joint sits just behind the groin, only inches from the lower spine, and the nerves from your back run straight through that whole region on their way down the leg. So when the hip is the problem, the brain can place that pain in the back, and when the back is the problem, it can place it in the hip or the buttocks. The body is bad at pinpointing the true source of the pain. That's not you being confused, that's the anatomy being genuinely confusing. So let's separate them, starting with their location. The first clue is the location, and there's a shortcut I use. Think about your pants pocket, front pocket or back pocket. Pain in the front, around the groin, the crease where your leg meets your body, points towards the hip joint itself being the problem. Pain in the back, towards the buttocks or the back pocket area, points more towards the spine or the SI joint. And here's why that works many times, because it's not arbitrary, it's anatomy. Your hip joint is a ball and socket sitting deep behind the groin. So when that joint is worn or inflamed, the pain shows up in the front where the joint actually is. The nerves from your spine exit in the back and travel through the buttocks, so spine-driven pain tends to set up shop back there. Front versus back isn't a trick, it's just a map of where each structure sits. Hip joint pain also tends to be deep, and it often flares when you load and rotate that joint. Think getting out of a low car seat or putting on your shoes and socks. And there's a mechanism here too. Putting on your socks or climbing out of a low seat forces the hip into deep rotation while it bears weight. If the joint is the problem, asking it to rotate and load at the same time is exactly what sets it off. But location alone isn't enough, because the buttock is exactly where hip and spine overlap the most. So we add the next clue. Here's the one I promised, the clear single tell. How far does it go down the leg? Hip pain can radiate into the groin and down the front of your thigh, but it usually stops at or above the knee. Pain that travels below the knee, into the calf or the foot, usually points strongly towards the spine and an irritated nerve. Let me tell you why that line at the knee matters so much. When a nerve root gets pinched in your spine, that pain travels the full length of the nerve, like a wire that has been pinched at one end and sparks all the way down. That's why spinal nerve pain can reach past the knee into the calf and the foot, and why it brings numbness, tingling, or that electric feeling. Those are nerve signals. A worn hip joint can ache and refer pain towards the knee, but it doesn't usually spark down a nerve into your foot, because the problem isn't a nerve, it's a joint. So a numbness, tingling, or that electric shooting quality down the leg, and you're even more into spine territory. So when those things happen, usually a nerve, not a joint. The third clue is what happens when you move. And I want to describe the patterns here, not try to hand you a test to diagnose yourself with. Hip-driven pain tends to track with weight bearing on that joint. Walking, standing, pivoting, and stairs, people often notice it putting on socks or climbing into a car. Spine-driven pain tends to track with positions of the back. Bending, prolonged sitting, or sometimes standing and walking upright, is by leaning forward. If that last pattern, worse walking, better leaning forward, sounds familiar, that's a lumbar stenosis pattern, and I've got a whole video on it. The point here is simple. The hip reacts to joint load, the spine reacts to back position. Now, let's talk about the clue that catches what the others miss. Here is where people sometimes get sent down the wrong path. You get an x-ray, it shows some hip arthritis, and everyone assumes that's the answer. You have hip pain, so It must be the hip arthritis. But the problem is that almost everyone past a certain age will have some arthritis on imaging, on their back, on their hip, kind of like, in their body. So finding it doesn't prove that that arthritis is what's hurting you. This is the rule I come back to in every video. Imaging and symptoms have to be interpreted together, never one without the other. A picture of arthritis next to a story that doesn't match it can point you the wrong way. Sometimes the way we actually settle it is with a numbing injection into the spot we're thinking is causing the pain. If the pain goes quiet, that usually tells us that's where the pain is coming from. That's a diagnostic tool your doctor may reach for sometimes. It's not something you can sort out at home. Now, let me clear up 3 myths that send people down the wrong path constantly. Myth 1, my x-ray shows hip arthritis, so my hip is the problem. Again, not necessarily. Almost everyone past a certain age has some wear on imaging, so finding it doesn't prove it's what's hurting you. Myth number 2, if the pain is in my buttock, it must be sciatica. The buttock is the single most crowded address in this whole story. Your spine, your sacroiliac joint, your hip, and a muscle called the piriformis can all send pain there. So buttocks pain is the start of the question, not the answer. Myth number 3, I'm too young for hip arthritis, so it cannot be my hip. Hip problems are not only an older person thing. Younger active people get hip issues too, things like impingement or a labral tear. Now the part that breaks every neat rule I just gave you. Plenty of people don't have a hip problem or a back problem. They have both. There's a name for that. It's hip spine syndrome. A stiff arthritic hip changes how you stand and walk, which loads the spine, and a bad back changes your gait, which stresses the hip. So one fits the other. When that's happening, the front versus back rule and below the knee rule can both be true at the same time. And that's not the rules failing, that's actually 2 problems happening in the same person. Before I give you the honest truth about all this, let me make your next appointment more useful, because the right answers from you change how fast your doctor finds the source. 1, where does it hurt most? The front, near the groin, or the back in your buttock? 2, how far down does it travel? Does it stop above your knee, or does it go below all the way into your calf or foot? 3, is there any numbness, tingling, or weakness in the leg, and has the leg ever felt like it might give out on you? 4, what makes it worse? Is it walking in stairs and getting out of a car, or bending, sitting, or twisting? 5, has it changed how far or how comfortably you can walk? Write those answers down and bring them. That's not busy work. Those 5 answers narrow the field faster than almost any scan because they tell a trained examiner where to look first. So here's what I won't do, which is tell you which one you have. I cannot from here. What I'll name plainly, a hip surgeon and a spine surgeon can look at the same person and need to talk to each other to get it right. If the hip turns out to be the driver, arthritis, a labral tear, impingement, that's a conversation for a hip specialist, and I'll send you there because it's not my lane. Everything I gave you, front versus back, above versus below the knee, joint load versus back position, those are clues that help you ask sharper questions. They are a probability, not a proof. A real answer comes from putting your history, your exam, and your imaging together. And even then, what we reach is a differential diagnosis, which is our best supported explanation, ranked in order, and then we're still open to being wrong when your body says otherwise. If this helped you frame the question, the rest of this series breaks down the other impersonators: piriformis, vascular claudication, and SI joint pain. And if worse walking, better leaning forward hit home, start with my lumbar stenosis videos. I'm Omar Ramos, a spine surgeon at Twin City Spine Center in Minneapolis, Minnesota. I'll see you on the next one.